Stephanie Belflant joins us now, and today we're talking about abdominal aortic aneurysm. And if you have questions, you can send them to the doctors at WLBT.net.
Joining us is Dr. Stuart Horsley, a cardiovascular surgeon at Baptist Medical Center. And I know that this aortic abdominal aneurysm is a serious condition, but it's also just a very frightening condition. You want to explain it to people?
Sure. Abdominal aortic aneurysms are essentially a weakening in the abdominal aorta, which is the main artery carrying blood to the rest of the body. They don't just occur in the abdominal area. You can get aneurysms anywhere in any artery. It just happens that the aneurysms that occur in your belly tend to be much more common than the ones that can occur in the chest. The frightening thing is that these aneurysms usually have no warning signs. They are essentially a bulge in the aortic wall, like a weak spot in a tire, and often the first sign or symptom of these aneurysms is a rupture, which can cause death. In fact, if an aneurysm does rupture, only about half the people, 50%, will even make it to the hospital alive. And of the 50% that do make it, only 50% of those ever survive it. So if your aneurysm ruptures, you've got a very small chance of surviving it, and that's why it's important to pick up on this.
Now, you mentioned that they're not really, it comes on suddenly. Are there any symptoms, any warning signs? I know that a lot of people can't take aspirin because it causes bleeding. Would it be something like that?
Well, pain is one symptom of aneurysms, and I get a lot of calls from other physicians. Patients come to the emergency room and they're having abdominal belly pain, and they get a CAT scan just to look for various causes of the pain, and an aneurysm is found, and we get a call. It is actually pretty rare for an aneurysm to cause pain until it ruptures. There are exceptions to that. There are something called inflammatory aneurysms, which can cause pain at any size. When aneurysms grow very rapidly, they can push on other organs in the belly and cause pain, but usually an aneurysm doesn't cause any symptoms until it ruptures. And the vast majority of aneurysms now are found just incidentally. People get so many CAT scans these days for other problems, for abdominal pain. Even sometimes CAT scans that start in the chest will extend down into the belly, and that's the way we find most aneurysms, is either through incidental CAT scans or an astute physician, family practice doc, picking up on a bulb, a pulsatile mass in the belly during an exam.
Is there any kind of test that you can do besides, a CAT scan that you would be able to know that this could be a possibility coming for you down the road?
Sure. The most non-invasive way to screen for these is just an abdominal aortic ultrasound, and that's just like the ultrasounds that pregnant women have. And we're actually having a screening at the Baptist Cardiovascular Center this next Saturday, August the 22nd. And people that should probably be screened are those that are going to be at highest risk, and that would include most men over 55 to 60 years old, women certainly over 60 years old, and then anyone who has risk factors, and those would include high cholesterol, high blood pressure, diabetes, and especially those who smoke have a markedly increased risk of developing all types of atherosclerotic heart and vascular disease, including aneurysms.
Is that screening free?
It's $35 for not only the aneurysm screening, but also they will screen for lower and upper arterial disease, peripheral arterial disease that can cause leg pain when you walk, or in some circumstances limb-threatening peripheral vascular disease.
Give us that information one more time. When's that going to be and where?
It's going to be from 7 in the morning until 11 in the morning, August the 22nd, at the Baptist Cardiovascular Center at Baptist Hospital.
$35, and people need to register now, I guess?
They can register online, or you can register when you get there.
Okay.
Well, that's a great program. Thank you so much.
Absolutely.
We appreciate it. For more health news, you can log on to WLBT.com and click on Medical Matters.